So you've started your dietitian private practice and you're not quite sure if you should take insurance or not. You've probably heard lots of myths about what it's like to accept insurance in your dietitian private practice. So you might have heard things like it's time consuming, or they just don't cover anything, or it's complicated, or insurance doesn't pay well. My name's Sheena, and I'm a registered dietitian that has been operating my own one-to-one private practice accepting insurance for the past decade. And I want to help other dietitians do this in the simplest, laziest way possible. Today, we're going to debunk some of those myths around accepting insurance and talk a little bit about what I call the alphabet soup of accepting insurance in your private practice. Some of this can sound a lot like jargon, but I promise it sounds way more complicated than it actually is. So, should you or should you not take insurance? Let's go ahead and start there. I firmly believe that if you're providing one-to-one consultations only for patients as a dietitian, you definitely should take insurance if insurance companies in your area do contract with dietitians. In most areas in the United States, most insurance companies do contract with dietitians. However, this will vary from area to area, and also there are some caps on the number of dietitians some insurance panels will allow in. When these caps are reached, this is called a closed insurance panel. And we're not going to dig too much into this. Even if your area has a closed insurance panel, there are also some ways around that to still get contracted with insurance. Okay, so should you take insurance and why? So the reason I say that all dietitians should accept insurance is because it expands people's ability to receive your care, and registered dietitians are some of the only nutrition providers that are able to accept insurance. So this really distinguishes your practice from someone like a nutritionist's private practice. The next reason that I think that all dietitians should take insurance is it really allows patients to access your care. And honestly, it's just not that complicated. And it increases your exposure in the communities. So you'll be listed as a provider on insurance websites so people can get more access to your expertise. This can also help you get clients, by the way, especially if you're a new private practice owner. Perception about credentialing with insurance is that it's really complicated. It's not. Either credentialing or submitting claims is a complicated process. Yes, it is a step-by-step process that honestly sometimes can be a little bit of a pain in the ass, but it is not difficult. It is not complicated. I promise you have done more difficult things. I like to explain credentialing with insurance is it's about the equivalent of how much time, effort, and energy it takes to fill out a job application. So if you've ever filled out a job application for becoming a dietitian, that's about the extent of how complicated and difficult this process is. So, what do you need to get started with credentialing with insurance companies and beginning to accept insurance? So, the first thing that we are going to need to do is we're going to need to get something called an NPI number. Pro tip on this, if you are an organization that has employees or plans to hire employees in the future, you will need both a type 1 NPI and a type 2 NPI. All dietitians should get a type 1 NPI. Whether or not you plan to take insurance, insurance providers is that dietitians are professionals that are interested in accepting insurance so that way we are more valued in this space. So even if you don't plan to take insurance, I still actually recommend that you get a type 1 NPI. You may actually already have a type 1 NPI if you worked for another facility, such as a hospital. A type 1 NPI is kind of like your social security number. So if you were a provider at a hospital and someone billed on your behalf, you already have a type 1 NPI. A type 2 NPI is an organizational NPI. So that's going to be the NPI for your facility. When you contract with insurance companies, you can contract with just your type 1 NPI if you're the only provider in your company, or a type 2 NPI. Pro tip: if you're planning on hiring employees in the future, even if you don't have employees now, I would recommend contracting with insurance companies with a type 2 NPI, because that allows you to put your own personal NPI on there when you see patients, but also saves the potential for you to contract other dietitians in the future. The next thing that you're going to want to do if you're planning to take insurance is fill out what is called the CAQH. And what this is it's kind of like an application hub for accepting insurance. So many insurance plans, private pay plans, will use the CAQH in order to contract with dietitians. This is really nice because it actually saves you a lot of time. So for example, if you are planning to contract with Blue Cross Blue Shield and United Health Group, etc., it's likely that you're just going to fill out that one CAQH application, and then you'll call up each of these agencies and ask to be put on the roster for credentialing. It will save you a lot of time. However, not all companies use CAQH, so you should prepare for the possibility that you may need to fill out CAQH and additional applications if you're planning to become credentialed with multiple companies. Now, you can pay a credentialing service to do these applications for you, such as CAQH or each independent company's contracts. However, I honestly don't really see the point in doing this, because you're still going to have to provide that agency with all of your information anyways. So you might as well do it yourself and honestly probably save time. While it is a little bit time consuming, maybe an hour or two of your time filling out these applications, it's not hard. Grab yourself a cup of coffee, glass of wine, and just make a little bit of a day of it. Now, if you're wanting to contract with companies like Medicare or Medicaid, you're going to want to go to cms.gov, where you're going to credential and contract with these companies. A little bit different of a process for contracting with Medicare and Medicaid, which I'm not really going to get into today, as I don't really work too much with those companies, although I have in the past. What I will say is, if you're not somebody that takes diabetes and renal, which are the only conditions that are covered by Medicare, this might not be a place where you want to invest your time and energy. However, if you are someone that works with these conditions, Medicare can be a great place to contract with. The nice thing about Medicare and Medicaid is that their rates are public. You can see easily which are going to be getting paid for each unit. Of units, when we are billing insurance, we work in units rather than hours. So each unit is between 8 and 15 minutes. So when we bill insurance, we're going to want to select the appropriate amount of units for which we saw the patient. So for example, if we saw the patient for 13 minutes, we would bill for 1 unit. As if we saw that patient for 45 minutes, we would bill for 3. You see how these units in billing work in 15-minute intervals. I'll be the first to admit there's definitely a learning curve for learning how to get contracted with insurance companies and learning how to bill insurance companies. Once you get it, it's like that. And that is why I also do not recommend that you hire a billing service in order to do your credentialing, your verification of benefits, or submitting your claims. This can actually end up costing you time versus saving your time. And because a lot of these agencies are dealing with multiple disciplines, your billing actually might not even be right. There's only a handful of codes that we as dietitians are going to use to bill for our services. And once you get these down, it only takes me about 30 seconds to file each claim. If I see, for example, 6 to 10 patients per day, it only takes me less than 5 minutes to bill for those patients. So from my perspective, it's going to take me more time to actually submit the details of my claim to a billing provider who's going to take anywhere from 6 to 15% of my claim than to just do that work yourself. That myth of it's time consuming is just inaccurate. However, I will say where that comes into play is if you do receive any audits from insurance, which is relatively rare, or if we have somehow messed up our billing or that insurance company themselves has made an error with the billing. Sometimes those do take a little bit of time, but I will say, in my experience of billing insurance for 10 years, this often accumulates to maybe 4 or 5 hours a month for just kind of troubleshooting any little offset things that happen with insurance. Now, if we do get something like an audit for a patient, one thing that you need to know is that we do need the date of service, the duration of the service, the patient's name, what we saw the patient for, including what is called the CPT code and the diagnosis code on that chart note. As long as we include those things on every single chart note, even audits do not take that much time. And speaking of which, once we do become in network with these insurance providers, we're going to need to learn how to fill out what is called a CMS 1500 form, which is the official form that we're going to submit for each patient in order to receive our pay from these insurance companies. Truth be told, I actually don't know what CMS 1500 stands for, and it's really not that important. The important thing is there's really only a couple things that we're going to need to fill out on that form after we've kind of auto inputted all of our company details into our EHR platform. EHR platforms are electronic health records platforms, which, if you are accepting insurance, I definitely would say that this is pretty much mandatory. But once you get things like your NPI and all of your business details into your EHR system, your entire CMS 1500 form is basically already filled out. So you don't have to do that each time. A lot of us look at all of those boxes on the CMS 1500 and just get extraordinarily overwhelmed. But I want to assure you that we don't need to fill out every single box. So resist the urge to think that we have to fill out and check every single box on that form. Really, the only thing that we need to fill out is what is called a CPT code, which dietitians really only use two, maybe three CPT codes, which are usually 97802, which is for our initial assessment, 97803, which is for our follow-up session, and potentially a group code, which honestly I never use, so I don't really use that code. And then we will also input what is called a diagnosis code into the CMS 1500 form. Now, usually a diagnosis code is provided to us by the medical provider because dietitians are not legally allowed to diagnose anything other than BMI, and we can also use a preventative code such as Z71.3 if we're providing preventative health care rather than treating a diagnosis such as diabetes. If your patient has a condition such as diabetes, cancer, etc., we're going to need to get those diagnosis codes from the physician, which will be on our referral. All right, hopefully you're hanging in there. Like I said, there's lots of little steps in billing insurance, but none of it is difficult. And especially for dietitians, there's not a lot that we need to know. And once we get these things down, it really is not that big of a triumph to be doing our own billing. Another reason that I highly encourage dietitians to get contracted with insurance is that they do actually pay pretty well. And many insurances provide their members with absolutely free dietitian services. For us as the dietitian, typically our rates are anywhere between $100 to as much as $400 per hour. Now, I can't discuss specifics of this, and I actually highly encourage you to not discuss specifics of the contracted rate that you have with an insurance company either, because that's actually illegal. We're not allowed to discuss our rates. However, I can tell you that my lowest payer is around $108 for 4 units, which is about an hour, which is my usual consultation time frame. Now, once you get contracted with insurance, I would recommend joining some Facebook groups such as the Insurance Credentialing and Billing for Dietitians group, because You just pop a question in there, and there's about 15 dietitians that are going to be able to address the specifics of your question. I wouldn't really recommend reading any books or going through any courses, honestly, unless they're courses that are redone often for billing and coding, because these just change so rapidly. Even diagnosis codes can just change so quickly, even what is accepted, the type of code that we're going to use for each condition, etc. So it is something that you kind of have to stay up to date with. But once you do that, honestly, billing and coding is very, very simple for dietitians. So, billing insurance is not complicated, it's not time consuming, it pays well, and it covers many medical conditions. While it is true that Medicare only covers renal and diabetes, most insurances, including Medicaid, are going to cover a wide array of medical conditions. And it is absolutely worth it if you are a dietitian to consider contracting with insurance companies for your private practice. If you found this information helpful, please consider liking, subscribing, and sharing with a friend.